Welcome to the LowCarbUSA podcast, where we seek to inspire you to help us build this community. I'm Doug Reynolds.
And this is Pam Devine.
Hey there. So I've got Paul Kolodzik with me today. He's a MD with emergency medicine background, and he was about to launch a book or publish a book that he's just written called The Continuous Glucose Monitor Revolution for Non-Diabetics. And that immediately struck a chord with me because I have, for the longest time, been advocating that in our community, especially, the use of a CGM would be so useful and so beneficial. And I was even chatting to you before we started this interview saying that I feel like it should be compulsory for doctors to wear one for at least a month before they're even allowed to practice. But that's my opinion anyway. But yeah, Paul, welcome. And maybe give us a bit of a background of where you come from, what your practice was like, and how you kind of got into this metabolic health space, and then how that migrated to these thoughts on continuous glucose monitors.
Great, thank you. So my background's in emergency medicine. I'm now double boarded in emergency medicine and preventative health, but I spent 25 years in the emergency department. And really what made me gravitate toward more interventional, preventative metabolic health approaches is all the disease that we see there. And I think, I kind of came to the conclusion after a period of time that maybe even a majority of the disease we see in the emergency department, I'm talking about vascular issues, peripheral vascular disease, congestive heart failure, strokes, end-stage kidney disease, really boils down to two things. The musculoskeletal issues we see boils down to really two things, and that is blood sugars being too high, and as a result of that and integrated with that, people being overweight. So it's really, you look at those two things. Well, what gets all the press in the emergency department is the gunshot wounds and, the overdoses and the motor vehicle accident. But what we see day in and day out, all day long, is the vascular issues and the issues related to obesity. So I got motivated about 5 years ago to, proceed with putting together a metabolic health practice. So I've moved from the reactive side to the preventative side.
Okay, so as I mentioned in the introduction, CGMs is a big thing. So what kind of prompted you to decide that it was worth writing a book about this?
Well, I think that these are tremendous tools, as you just talked about. They're tremendous tools for individuals, and they've been relegated to diabetics. In fact, not only diabetics, but diabetics that are on insulin. Really, insurance approval generally is only for diabetics that are managing their insulin. But if you use one, you get a great sense of what is going on with your physiology. And it started with me. My sister was before I even got into this, my sister was kind of a low carb person, and she did a trial of one, and then I did a trial of one. And, the data that you see as a result of what you put in your mouth, it is just amazing. And I, now bring patients in and I put them on. And a typical story, Doug, is, you see people that come in and they say, well, I just want to lose 20 pounds, or I just want to lose 30 pounds. And it's like, do you have any health problems? No, I just need to lose some weight. And you put one of these on them for a 2-week trial period of time. And, you're seeing sugar spike to 180, 220. You're seeing people that, are just there for weight loss that not only never knew they were pre-diabetic, a lot of those, but people that have blown through that phase and are diabetic. And a light bulb goes off in their head. That they understand for the first time what's going on with their body and why they're overweight and why diabetes runs in their family. And provides them a basis for intervention. People get religion real quick looking at this data.
Yeah. But you mentioned something a bit earlier, talking about like it's being utilized for people with diabetes, but in fact, it's kind of really difficult to acquire one if you're not diabetic. And so that was a big question I had for you when I first saw, what this book was about. Was like, how do you teach people to, or what do you teach people in terms of how to get hold of one of these if they're not, if you said, like you said, they just want to lose a bit of weight, they just want to adopt this ketogenic diet to be healthier because they've learned that that's what it's going to help with. But they can't just walk out and go and buy a CGM.
No, you can't. And I advocate, as you and I discussed, working with, a growing number of metabolic health providers like me. You can find them. I mean, get on the LowCarbUSA provider, site. You can find those in each state. As we talked about, a number of clinicians now are getting credentialed in a number of states. I'm in Ohio, Indiana, Florida, and Arizona. But all you got to do is look for a metabolic health provider. They will have the expertise to guide you through this process. The opening of the book really talks about why this kind of practice is needed, because typically now people go to their doctor, once every 6 months or once a year, and it's a 20-minute visit, and there's really not time to get into the things that we're talking about here. A structured program that might include, a low carb approach guided by a CGM, some intermittent fasting, some strength training, all the things that I think are real familiar to me and you. But the docs in their offices, unfortunately now, and this is not slamming primary care docs, because they do great work, but they usually get 20 minutes with a patient, and it's they're relegated to kind of how are we going to tweak your hypertensive medication, or do we need to change your blood sugar medication? And so my goal in my practice is to complement them. I'm not managing disease, but I complement this with a metabolic health preventative interventional approach that will help get to the root cause of the issues.
Yeah, I think you talked about it, or you sort of touched on it already, but if even one of the reasons I think is the powers that be feel like people shouldn't have access to these CGMs is like, unless they're guided in terms of how they respond to the data that they see, maybe feel that could be a bit dangerous. But I think that that's what you're talking about, is if they can be working with a team of metabolic practitioners, because that's more about the whole team is more than just the doctor, right? The doctor starts by diagnosing an issue, possibly, and advocating that this metabolic approach is the way to go. But that's about as much as they can really do in the time that they have. And it requires coaches and other people in the team to actually help this patient then get it done. Maybe you can talk about that a bit more.
Yeah, I mean, to touch base again on the current way medicine is provided in the country, I'm just gonna give you a little historical perspective. It's kind of different than when I got out in residency. It's like back then it was docs in small groups, or even docs individually hanging out a shingle. And the approach, they were basically small business owners, and the approach I think was a little bit different. And now, most primary care docs, unfortunately, are employed by usually health systems, some large private, even public companies, or Wall Street type companies. And so it's a little bit different approach, and they really don't have the time to address the things that we address. So, what we do is bring people in, and, I call it a 2-week trial, and bring people into a full initial metabolic health evaluation and put a CGM on. And let them use that for 2 weeks. And then we do, some routine labs, lipids, and comprehensive metabolic profile, but most importantly, a fasting insulin level. And the fasting insulin levels are not commonly used in American medicine now. Usually only the metabolic health docs are doing it. And then I bring them back in after that 2-week period of time, and we go over their data. Let's look at what your CGM curves look like. Let's look at how high your spikes are. Let's look at how high long you stay above average. And then based on that, put a comprehensive plan together. And that plan really is what the book is about. It's like, once you get that initial diagnostic phase done, where do you go? What are the components of a comprehensive plan to get you the results you need in terms of weight loss and improved metabolic health?
But do you use the CGM as a tool to try to convince them or show them that adopting this a lifestyle change is necessary? Because I think I asked that because I feel like a lot of people have no idea. I mean, even me, years down the road of being, immersed in this, I only wore a CGM for the first time a couple of years ago. And I was like blown away by some of the things that I saw. So how does a person who doesn't know anything about this, I mean, when they see these big spikes in that, it doesn't actually mean anything to them. How do you teach people about that?
So we review their data. Again, I think you need to be working with a metabolic health provider who knows how to interpret and explain that data to you. And that's what I do with my patients. Every time they come into the office, we look at their data. And, I can monitor their data remotely as well, as I'm sure you're aware.
Right.
And some of that accountability is valuable to some patients as well, that they know somebody is kind of following what's going on. But after a while, they can get to understand the spikes, the typical hyperglycemic spike followed by an insulin release and associated hypoglycemia.
Right.
And, that's why I don't have energy in the
You feel like
afternoon, or
shit,
that's
yeah.
why I can't remember anything after a big lunch or a big dinner. So they learn over time, but they got to be working with somebody that knows how to review and explain this data to them. And then the device itself can be life-changing. In fact, the last chapter in the book is CGMs Change Lives. Because just seeing your curves for the first time and understanding, why do you have difficulty losing weight? Now it becomes self-evident. And then after that diagnostic phase where, people really do get religion. I mean, I have people, I put a CGM on them and their life is changed. It's like, after you eat that piece of cake and you see that spike, you can never unsee it. It's true. You can never unsee it. You know what's going to happen.
Yeah.
And you know that it's going to affect, your future health and well-being. So they get religion themselves with that, and then, go through a therapeutic phase using the CGMs.
Yeah, I mean, just take a bite of cake and you just see this spike on your in your peripheral vision. You can just see it happening. But do you find that you kind of did say something to that effect? But so how many people have you literally put this on with the idea of showing them this because you're trying to convince them that they need to make these changes, but they don't want to? So then put this on them, and then they get to see this and change as a result. Have you got a lot of examples of that, or do you?
Yeah, I mean, so So you see an occasional patient that doesn't have a lot of variability on their CGM, doesn't have any insulin resistance, but my patients self-select. They come to me because they're overweight and they have likely metabolic health
Right.
patients. So I'm in the thousands of patients now that we have gone through this process of really doing a diagnostic phase, and then a lot of the book again about is okay, so once you have this information and once you're impressed that you have to make changes, then what is the plan? And it's usually a CGM guided low carb diet, intermittent fasting. I work with people progressively on how long that's going to be. And then strength training is big, because if you can increase your muscle mass, you can decrease your amount of insulin resistance more effectively. So it's really kind of a comprehensive program like that. And once people see their spikes, they buy in.
And you
and
say
again,
and I'm just interested in engineer and stuff, I suppose, coming out of me, but percentage wise, like how many people that you're doing this to try to show them that they need to make these changes, how many of those people actually come on board once they see the results?
I think everybody tries to come on board.
Oh, okay.
They all understand. I think there is a minority of patients that don't have the wherewithal. You got some people that, for example, are relatively immobile because of their size, but I would say it's 10 or 15% that don't make changes. 85% are on
Wow.
board and do make changes. And quite honestly, that's one reason that I'm doing this now, because when you have somebody that has metabolic syndrome, to tell you this, because you see it, as part of what you do, but they have metabolic syndrome and then they lose 40 or 50 pounds, and their A1C goes, from 6.3 to 5.4. And during that time on a low carb diet, their lipids get better as well.
Right.
It's very satisfying for me from a clinical standpoint to see that. So
Yeah, I mean, there's so many docs that I know now that are doing this now, that are that's what it's about. I mean, and you go to people as famous basically as Brian Lenskes. I mean, Brian was really jaded and only really discovered this by doing it for himself and noticing these improvements, and his patients were all commenting on improvements in his weight loss and his looking healthier and everything. And then he came to our event and learned that it wasn't just it was a really legit thing. And then he started talking to his patients about it. But I mean, and I tell the story sometimes. We have a local, well, I'm not in San Diego anymore, but we used to have a local San Diego meeting, and Brian was almost always there and spoke there pretty frequently. But afterwards, you know what it's like at any of these meetings and stuff, like people kind of congregate around the speakers, whatever, and ask questions and have a conversation or whatever. And it was that period of the meeting at one day, and he was in the corner there, like jabbering away to this crowd of people. And Pam and I were standing with his wife.
Yeah.
And she was saying, "What have you done with my husband?" Like, seriously. She said, like, he was reserved, and at a function or whatever, he would be the guy that would go and sit in the corner and be saying to her, like, we need to go now, sort of stuff.
Yeah.
And now he was just so animated and so and everything in his life changed, because he was suddenly helping his patients.
He was so, and Brian is one of those guys that came out of what I talked about, that kind of a corporate medicine setting where he was only allowed 20 minutes with his people. And then he took the risk. he took the risk of stepping out and doing his own practice to help people with metabolic health and some direct primary care. And he is so much more professionally satisfied now.
Yeah.
And I identify with that. I mean, I have enjoyed my work in the emergency department, but a lot of the damage is done after people come in with an acute event like that. And now I'm getting to help people prevent those issues. And so I understand the passion that he has. I have it as well. It's very satisfying.
Yeah.
Oh, and just so you mentioned Brian, and I just want to do a plug for the look, and this is not a paid promotion, the LowCarbUSA events. Okay. You talk about the buzz and the passion among people. I went to the conference in Boca just here, probably 3-4 months ago,
Back in
something
January,
like that.
yeah.
Yeah. And the passion of the people in that room and the quality of the presentations is unbelievable. If people want to get a feel for what the low carb community is like and what the possibilities are, whether you're just an individual or you're a clinician, then go ahead and go to one of these conferences, and you, like Brian and I, will be hooked.
Yeah, I mean, I appreciate you saying that. It kind of validates what we do, because, like you said, this was obviously not arranged, and for people to, and we hear it regularly, for people to come and of their own free will tell us or tell other people about how much it's helped them and how much it's helped to inspire them, makes us realize that what we're doing is worthwhile, and that's really cool too.
Yeah, it's been fun. It's rejuvenating. I mean, for me, it's I mean, working in the emergency department for 25-30 years was hard, but this has kind of rejuvenated me. So
yeah, that's awesome. So let's to close this off, I think, let's go back to the book. I will put all the information into it, but maybe so it's the Continuous Glucose Monitor Revolution for non-diabetics. And how do people go and get it? Is it even out yet? And if
yeah,
not,
it's actually
when will
out
it be out?
yesterday.
And
Out yesterday. Audiobook, I think it's still going to be another week or two. But just go to Amazon, the Continuous Glucose Monitor Revolution, or if you Google Kolodzik, if you can remember, or search Kolodzik, it'll come up. I appreciate you putting the information on the website. And basically it is an intro, talks a little bit about the history of how we got into this mess with the epidemics of diabetes and obesity, and that 60% of Americans are overweight. And then we move into understanding how to do a low carb diet and the low carb diet options, and then chapters after that on using your CGM and how to interpret the data, strength training to decrease insulin resistance, intermittent fasting, all tools that help people meet their goals. And I actually got a chapter in there a little bit, though got to be careful not to lean on this too much, related to the new FDA approved weight loss medications, the Ozempics, Wegovy's, Mounjaros, which I think can be helpful in this process if people hit a plateau. But the other components, or the lifestyle change components, are the most essential components. But yeah, it's on Amazon. And then if I can put a plug in for my practice, it's metabolicmds.com. So the word metabolic and MDS.com, and I'm licensed in Ohio, Indiana, Florida, and Arizona.
I was about to say, like, which states are you licensed in, but you jumped in with that. Okay. Well, that's very cool. Yeah, Paul, always happy to try to help people that are trying to do something good in this space, which you obviously are. Thanks very much for writing this book. I think it was it's really important information that people need to get their hands on, and I think it's going to be a source for docs and that to maybe show other doctors and patients why it is that they should maybe consider using this as a tool. Because I
and
think this is, like you called it a revolution, and I really believe it is. I think it's so powerful.
And this is, I mean, it is kind of the first book, I mean, there's information on websites and stuff, but it's kind of the first book that talks about how to utilize this tool, the CGMs, as part of a comprehensive program. So all the information is in one place, and I'm hopeful that that's helpful to people.
And it feels like it's going to be really good for the doctor and the practitioner, as well as the patient. It's going to serve both communities, which is
Absolutely.
a lot of the
For
time
docs,
books will either be one or the other, but I
yeah.
feel like this one's going to be good for both.
And that was the intent, because there are a lot, docs get 4 hours of nutrition in medical school. So there are docs that have a little bit to learn. Hopefully, they'll be in an environment where they have the time to apply it and help their patients with it.
Or they're allowed to apply it.
Yeah.
Like you said, you talked about Brian and his practice. He started actually almost on the side, like coaching some patients that wanted to doing this. But he got so much pushback and so much bullying and hassles from his other partners in the business. That's why I eventually decided, like, screw this, I'm going to do my own thing. Yeah, again, thanks for doing this, and thanks for being on the show. And hopefully we see you at another event pretty soon. Coming to San Diego or Boca?
I'm going to miss San Diego, but I'm going to plan on heading back to Boca.
I'm trying to head to Boca again next year.
I assume. Yeah.
Yeah, no, so it's going to be, it's cool. Like this year, we had that one day we focused on food addiction. We're going to have a focus on type 1 diabetes this time. That is very underserviced in terms of a condition that can be at least well managed by utilizing a metabolic approach. And then non-alcoholic fatty liver disease, we're going to have a few talks on that as well. So those are the things we're going to focus on in January. We've got a whole big thing, the San Diego event. We've got a whole day focusing on cancer. We've got a really, really cool lineup for that with Miriam and Dom D'Agostino and Matt Phillips from New Zealand and Anthony Chaffee's coming from Australia, and we got a really, really good lineup for that cancer day. So
sounds great.
Yeah, encourage everybody to come to one of the events. It literally can and will often change your life.
Yeah, I agree.
Okay, thanks, man.
All right, thank you very much, Steph.
Yes. You've been listening to an episode of the LowCarbUSA podcast. You can support us on Patreon at patreon.com/lowcarbusa.